Heart failure with reduced ejection fraction, HFrEF, and heart failure with preserved ejection fraction, HFpEF, are two major types of heart failure, and the main difference is how the heart is malfunctioning. HFrEF is a problem with the heart's ability to pump blood forward. The left ventricle becomes weak, so it cannot squeeze effectively. This leads to a low ejection fraction, usually below 40%. HFpEF is a problem with the heart's ability to relax and fill. The left ventricle becomes stiff, so even though the squeeze is normal, the heart cannot fill with enough blood. The ejection fraction stays normal or near normal, typically 50% or higher. In terms of what the heart looks like functionally, in HFrEF, the ventricle acts more like a stretched, weak chamber that fills normally but cannot eject well. In HFpEF, the ventricle is thickened or stiff, so it fills poorly even though the pumping function is preserved. Common causes of HFrEF include coronary artery disease, previous injury to heart muscle, long-standing high blood pressure that weakens the heart, and dilated cardiomyopathy. Common causes of HFpEF include long-standing high blood pressure, the most common cause, aging, obesity, diabetes, and hypertrophic cardiomyopathy. Both types share symptoms such as shortness of breath, fatigue, limited exercise tolerance, and fluid buildup. However, HFrEF symptoms often relate more to poor forward pumping, while HFpEF symptoms often occur when fluid volume increases because the stiff ventricle cannot accommodate extra filling. Diagnostically, an echocardiogram is the key tool for both. In HFrEF, the EF is low and the left ventricle may appear enlarged. In HFpEF, the EF is normal and the ventricle may appear thick or stiff. Blood tests such as BNP or NT-proBNP may be elevated in both types. Treatment differs. For HFrEF, there are several medication classes proven to improve outcomes, including ACE inhibitors or ARBs, ARNIs, beta blockers, mineralocorticoid receptor antagonists, SGLT2 inhibitors, and diuretics for symptom relief. For HFpEF, treatment focuses more on controlling symptoms and managing underlying conditions. This includes good blood pressure control, diuretics for fluid symptoms, managing diabetes and obesity, and sometimes SGLT2 inhibitors. There are fewer medications with proven outcome benefits compared with HFrEF. In summary, HFrEF is a pump problem, while HFpEF is a fill problem.